Are you an adult who's tired of looking like a teenager? It's estimated that nearly 85% of all people will have acne at some point in their lives. Today we'll meet Angie, a 41-year-old mother who needed to get some help getting rid of her stubborn acne. Let's find out how on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And then to good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking about adult acne. Acne is usually something we associate with teenagers, but it can be a real problem for all ages. Acne is the most common skin disorder in the United States, affecting more than 40 million Americans. In fact, 25% of just adult men and 50% of adult women will suffer from acne at some point in their adult lives. First of all, let's talk to the doctor who treated our patient, Dr. Barson. G'day.
Hey.
How are you?
I'm great, thanks.
Good. Okay. How many of your patients are actually adults with this issue?
By far the majority, probably over 95%.
And how do they feel about that mentally?
It's a devastating disease. Depending on the amount of acne that you have, it can make you a social outcast, at least in your own mind.
When you have an acne issue as an adult, when you say it can affect you in your own mind, but it's also how other people perceive you as well, because they think that maybe you don't take care of your skin, but that's not the issue at all, is it?
No, most of it's based on heredity.
How does it all start?
Well, it has to do with a defect in the way that the cells in the oil gland's underneath the skin, and it comes up through a little pipe, a little duct. And it's those skin cells that line the duct that have a defect. And they're sticky.
Right.
And they shed, just like your skin does.
Okay.
But when they shed into the canal, they stick and form a plug, which makes the oil back up. And the little bacteria in there start to eat it. And they excrete a fatty acid, which is very irritating. So a zit always starts as a redness under the skin.
Okay.
And white blood cells come in to attack it. You might wonder why what comes out of a zit, the pus, is white. It's because of white blood cells. It's not bacteria, really. It's mostly white blood cells.
Okay, well, can you explain to me, you always get told not to squeeze your pimple or it creates a hole in the skin.
Well, when you squeeze it, what it is, there's a bulb down there. This gland has gotten large and it's full of bacteria and white blood cells and all this stuff. But the wall is very delicate. So you squeeze it, you pop it, and you excrete that stuff out into the tissue.
Right.
And that's what creates really bad acne, and it creates extensive scarring because then your body really reacts to it and excretes an enzyme called collagenase that starts to dissolve your skin. So acne scars are always depressed. You lose skin.
Just listening to it, I think to myself, as everyone would at home, that now it's not just about the pimple, it's about what happens after the pimple is the right word, erupt?
Well, yes, that's
is
good.
Is that a good word?
Erupting is a good word.
Sometimes acne is beyond our control, but there is a great face washing routine to keep your skin looking fresh. Step 1, know your skin type. Is your skin dry or oily? Maybe it's sensitive. Using the right product for your specific skin type is the key to effective skincare. Step 2, cleanse, tone and moisturize at least twice a day. You want to make sure to remove all the dirt and oils from your skin before you go to bed. It's especially important to moisturize even if you have oily skin. Step 3, once or twice a week, exfoliate to remove all of the dead skin cells. Do not pop or pick at pimples as it will only make it worse and can cause scarring. And always remember to avoid touching your face unless you have washed your hands first.
So Angie has been our patient. She had adult acne. What had she done beforehand?
Well, she's done a lot of different treatments over the years. I believe Angie's acne started when she was about 23. Before that, she had none.
None.
I've never had acne.
If I suffer from acne, it's very little, maybe 1 or 2 spots every here and there.
Yeah, I was a teenage boy, so of course, everyone's been there.
I've suffered from acne before.
I have suffered as well.
I think a couple people in my family have suffered from adult acne.
I have a daughter that had a lot of acne, and she did do the Accutane thing when that was big. I know that's kind of extreme, but it helped.
I had a friend with acne. She don't feel comfortable. She don't feel she's beautiful.
Having acne at any age can have an effect on your confidence.
I do think it can affect your confidence. Proactive is where it's at.
You don't have to be a teenager to feel bad about yourself.
Some people could really benefit from like an acne, facelift like that. I think that's rad.
I think it's great. If you can afford it, do it.
If getting an acne lift helps with your self-confidence, and I'm all for it.
It can be good or bad. I don't know if it has like side effects.
I don't think that everyone needs to be doing it if they have a small problem, but I think it can help people's confidence for sure.
After the break, we'll be meeting Angie, who is one of the 50% of women who suffer from acne. Then we'll watch as Dr. Barson performs her acne lift procedure.
It's giveaway time on The Younger You. You could win a signed copy of my best-selling book, Guide to the Younger You, which takes you on the journey from a healthy soul to a healthy body. Be sure to head over to theyoungeryou.tv/contest to enter. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Before the break, I spoke to Dr. Barson about what an acne lift actually is. Let's go hear what else he has to say about the procedure, then we'll watch him perform an acne lift on our patient Angie.
How often does Angie need to have this treatment? Is it depending on the level of acne that you have?
Yes, it does. Most people do really well. Once you have the initial treatment done, every 3 to 4 years have a follow-up treatment.
A touch-up?
So to speak. And this keeps the skin in really good shape. In fact, it's one of the primary anti-aging things that we propose to people to keep their skin looking young after they've got it in the shape they want.
Okay.
To kind of freeze it there for long periods of time.
Okay. Dr. Barson, do you need to be on medication at the same time, or do you go off that altogether?
Usually you go off, but there are some people that, in order to keep the acne under control, if they have a regimen like certain antibiotics or things like that that have helped them, and they flare up without it, we keep them on it for that period of time. But we never want the acne to come back because it'll just start that whole process again. Acne is very hard to cure. You can control it.
Right.
But sometimes it comes back later, especially when you go through menopause. So there's menopausal acne.
What else does a woman have to put up with? Seriously. Like, she's going through everything and then she's got to worry about the acne?
Yeah. Well, I had one woman come in and she says, I have my son's acne and my father's wrinkles at the same time.
Well, speaking of wrinkles, you also did a mini facelift on Angie.
Yes, we did this
Why is that?
to improve the quality of the skin and to, you know, a lot of people actually look a lot better. If they have acne, they stand in front of the mirror and they go like, oh, that looks so much better. You make it look 90% better just by doing that.
So when you've done the lift, it actually pulls the skin out. Is that correct?
Yes.
So it doesn't look like you've got a crater in the skin.
Yes,
to the general person, that's
Much
what
better.
it looks like.
Sometimes we have to do follow-on treatments. I mean, the most extensive is where you actually cut the scar out, but that doesn't happen very often. Most of the time we can use very localized treatments on those spots to generate new skin within the spot so it grows and starts to fill in by itself.
Would you necessarily recommend the mini facelift with the acne treatment normally, or is it just by case by case?
Totally case by case. Everybody comes in with a different issue. And so we have people come in for a consultation and we sit down, we talk about their issues, what they expect, what they'd like to see. If people tell me what they want it to look like at the end, I can sort of tell them the path to get there.
I like that. I love that.
It's great hearing from Dr. Barson about what an acne lift actually is. Now let's go meet our patient Angie and find out why she needed one.
My name is Angela Mueller and I'm 41. I decided to have the acne lift because I've struggled with cystic acne for 20 years, and it's just the scarring from that, and I'd like it to be smoother skin, and that's what this procedure will do.
First of all, we're going to numb you up, and then in the areas where you have most of the scar, what we're going to do is use the portrait plasma system, and that will regenerate some new collagen and help with eliminating the scar to a degree.
I'm expecting to have the shadowing that I've not liked to be smoothed out and have the smooth skin that I've wanted for years.
And then we're going to do the lift, because when you do the lift, see, the acne just sort of disappears. I think that'll be great.
I'm excited.
What we're going to do is we're going to outline some of these areas for plasma and also for some filler, some of the permanent filler that we're going to use. Okay, that's good. That's all that's left. We actually just use tiny little dots of this filler. That's all it takes. A little goes a long ways. With this treatment, she's going to have a lot better presentation of her skin with the scarring, acne scarring. Plus, she's also going to look younger.
When you're younger, your skin is more supple and it's more resilient, but over time, it just loses that luster and the elasticity, and it starts to show more. My mom told me never to draw on my face.
You're not drawing on your face. I'm drawing on your face. Now this will feel a little pokey. So this is called tumescent fluid. It allows us to do this with very little bleeding, very little downtime, and people have almost no pain afterwards as a rule. That is very important. We get the whole area numbed good, because Angie's going to appreciate that, aren't you?
Coming up after the break, we're heading back into the operating room with Angie and Dr. Barson. Then we'll be bringing them into the studio to check out Angie's results.
Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Be sure to check out the Younger You website to watch full episodes of the show, stay up to date on the Younger You challenge, and get useful tips and tricks to help you achieve the Younger You. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
Before the break, we met Angie and watched Dr. Barson begin her acne lift. Let's go back into the operating room to see how they're doing.
You got it numb enough?
Oh yeah, you're numb enough. So go ahead and treat those spots. Portrait plasma was a device that was developed as an alternative to lasers and other treatments to treat the skin. And what this does is it runs nitrogen gas through a little quartz tube, and it hits it with a microwave energy, and it turns it into a plasma gas.
It's really a culmination of 20 years of looking in the mirror and wondering what other people see, what I see. I'm not big on makeup, so there's a lot of times I feel like that accentuates it. There's really no win-win when you have acne, dents, and shadowing. So I'm excited.
It creates a heat wound, and that causes the body to make new collagen, and that collagen helps fill in the hole, as it were.
I've already done 2 laser treatments, and I've had several chemical pills on my skin. It's been a huge improvement. I just feel like it's time to maybe make the next step, and that's what I'm doing today.
Okay, so this is where we start with our incision. Most people with this procedure, because we use this tumescent technique, will only lose like maybe a few tablespoons of blood or less. If she has very little or no bruising, she could be out tomorrow when you wouldn't know that she'd done this, once she fixes her hair. This is the most dramatic thing we do for somebody's face, but strangely enough, it usually has the least downtime.
Really, what I want is just to have the skin stretched so it's tighter. And then maybe I'll just be, hopefully I'll be done for a while. We'll see.
This is when you get your first idea of how it's going to look. You just do that. This is a special trichophytic incision that we cut on an angle so that the hair will actually grow up through the scar.
that up temporarily. And now we're going to go to the other side. We're going to do exactly the same thing, and then we'll close up the skin with some 2 layers of sutures.
I am doing this for myself because I have polycystic ovarian syndrome, and that can cause all kinds of other physical issues. Cystic acne would be one of them, and I did get that, and it was pretty bad. Like, they looked like bumps, like I bumped my head. And then smaller ones too, just all over. I've had them all over.
We've gathered the deep tissue and brought it up separate from the skin, and because of that, it lasts 4 or 5 times longer, I guess. Now see, if this was an older lady, see how much I'm pulling out the deep tissue? And I'm not pulling skin.
It's been a battle as far as a female identity, I feel like, and I've studied enough on it, so I've tamed it good enough, and this is just my way of saying, you know, you've survived it this long, and this is what you get. The icing on the cake.
Just go a little lower. Start right there. Perfect. Perfect. So you can see that these deeper sutures are kind of lining everything up, and they actually hold quite a bit of tension for a long period of time and keep it off of the skin scar. Otherwise, that scar will just spread apart. The 2-layer closure is actually very important to a successful lift, because you have to have that deep layer also closed and holding for months, because the skin scar is not strong enough to hold everything together for a long period of time. Now this is the skin suture, which gives us the final result, of the final smoothness to the suture line. 1/4 inches more. Yeah, that's fine, that's fine. Okay, that side's done. You just move you a little at a time, okay?
I'm ready to get in touch with my younger self, my pre-cystic acne issues, and go back to that.
Excited to see Angie's results? I know I am. When we come back, we're bringing her into the studio so we can see how she actually looks.
Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. It's giveaway time on The Younger You. You could win a signed copy of my best-selling book, Guide to the Younger You, which takes you on the journey from a healthy soul to a healthy body. Be sure to head over to theyoungeryou.tv/contest to enter.
Welcome back. Before the break, we watched as Dr. Barson performed an acne lift on our patient, Angie. Now let's bring her into the studio to see how she's looking. Hey, Angie.
Hi.
How are you feeling?
I feel great, thank you.
Good. Before we get into everything else, let's have a look at your before and after shots. What a huge difference. How are you feeling about that?
I feel great about it. It's amazing.
When you see pictures like that, Dr. Barson, how does that make you feel as a surgeon?
Makes me feel really good, especially if I can make somebody feel more confident and happy about themselves.
I'm glad you said confident. Angie, I wanted to ask you a question. When I saw your before shots, I look at that and you look like a beautiful woman and someone who's very confident already. When you have adult acne, how did that make you feel?
It's really difficult to see yourself with the acne, because when you're younger and you don't have that, you still want to have that youthful
that glow.
Skin, yeah.
Did you ever feel that you were unattractive? You felt unattractive?
It's probably all in my head, but yes, you do worry about your outward appearance.
You're an incredible looking woman. You're well put together. You were saying at 25, I believe, you discovered adult acne?
I was a bit younger, like 23, 22.
Yeah. How did that make you feel growing up with that into your adult life?
It was probably more difficult for me maybe than other people, because I did model when I was younger. So I always wanted to have that beautiful,
flawless look.
And then when I got the acne, I realized I had polycystic ovarian syndrome, which can cause cystic acne.
And did it get worse over the years? It just kept getting worse for you, or what treatments were you trying in the past?
It didn't get worse. It was bad for probably 5 or 6 years, and then I started learning more about it, and I used some of the treatments. I tried some antibiotics, the topical ones also, and I just didn't want to keep taking pills for the rest of my life. Yes.
How many treatments did it take to get this look? Because she looks incredible.
Well, she had 2 of the laser treatments. She had some plasma treatments before that.
Yep.
And then we did the acne lift.
Okay. Tell me, was it painful having the lift?
I didn't feel anything.
Nothing?
I didn't feel a thing. It was wonderful.
So, Dr. Barson does everything under local anaesthetic. Why do you choose to do it like that?
Well, it's safer, cheaper, and we usually get a better result, and there's less bruising, swelling, pain, and downtime.
I love that. How much downtime when you say that?
Well, the downtime depends. About 50% of women, the next day you could fix their hair and take them anywhere and nobody would know they'd done it.
Okay. What do your family and friends think?
They all love it.
Do they?
Yes.
Do they see it's such a dramatic result?
I think they see a great result. I wouldn't say dramatic.
I think, well, I'm honest with you. When I see your before pictures and now looking at you in person, it's a huge difference.
It is a huge difference to me, but I see myself every day in the mirror.
Yeah.
So, and they see me maybe once or twice a week.
Yeah.
You know, so they love it.
What
but
do you
probably
see?
not as much as me.
Well, I like that. I like that. What do you see when you look in the mirror now?
I think I see what I should have looked like without the acne.
If there's a message out there for all the women that are watching you who have adult scarring and sitting there thinking, if Angie can do it, I can, what do you want to say to them?
I feel what they're going through, and I think that they should do something about it. They can do something.
Yeah. And with the technology that we have now, there's really no excuses there.
No.
It's just that fear of...
It is probably scary.
Were you scared at any point?
A little.
Why?
I've never had any surgery, you know, and it's my face, but I've been seeing Dr. Barson for years, and I trust his expertise. So.
And is Dr. Barson, when you're working with a patient like Angie that you have done with over the last few years as well, is it really important to build up that relationship so she is feeling comfortable with the procedures that you're suggesting?
Well, that's part and parcel to the entire thing. Women rely on trust a great deal, and it does take a period of time before they come to trust you, and once they do, then it's more of an interactive thing.
I agree.
You know, I propose things and we talk about it, and they ultimately come to the conclusion of what they should do. I never tell people what to do, but we go through an interactive process of education and options, and at the end of that, usually it's pretty obvious what to do.
I think you're a great surgeon. I've enjoyed every minute of being in your office and you being here today. He's a great bloke, isn't he?
Yes.
I think you're a great surgeon. So thank you so much for both of you joining me today and allowing everyone to watch your journey throughout the younger you as well. If you want to find out more information about these procedures and what is possible for the 50% of women out there suffering from adult acne, head over to our website at theyongeryou.tv, and I'll see you next week.
Next time on The Younger You, we're talking all about your heart and how to keep it pumping. The Younger You set provided by Madison McCord Interiors.